Today's drug is Letrozole, brand name Femara. The therapeutic category is that it's an aromatase inhibitor or an antineoplastic agent. The main indication for letrozole is for hormone receptor positive breast cancer in women after menopause. The medication is used to treat and prevent cancer from returning in postmenopausal women. In early breast cancer treatment, it is used 5 years after tamoxifen. In advanced breast cancer, it follows antiestrogen therapy. There are many different off-label uses for letrozole. One of the uses is in other breast cancer variations, such as advanced, metastatic, HER2 positive, and HER2 negative breast cancer variations. Another off-label use is in infertility, ovulation stimulation in females with polycystic ovary syndrome, or PCOS. Some meta-analysis studies have suggested that letrozole is superior in the induction of ovulation in females with PCOS. Another off-label use is in recurrent ovarian cancer. Letrozole is used in platinum and taxane-resistant ovarian cancers and has been suggested, but the benefits need further study. And another off-label use is in pediatric uses in delayed puberty and growth in males, in McCune-Albright syndrome in females, and short stature in males. And of course, consult the most current literature if considering usage in any of these off-label uses. The main dosage form and strength for letrozole is the tablet. It comes in a 2.5 milligram strength. Dosing and indication. Dosing for advanced breast cancer in postmenopausal female adults. Initiate 2.5 milligrams by mouth every day until tumor progression. Adjuvant dosing for early breast cancer in postmenopausal female adults. Initiate 2.5 milligrams by mouth every day for 5 years and discontinue at relapse. Extended adjuvant dosing for early breast cancer in postmenopausal female adults. Initiate 2.5 milligrams by mouth every day for 5 years after 5 years of tamoxifen, starting within 3 months of tamoxifen discontinuation. Discontinue at relapse. Off-label use. Infertility in PCOS patients. Initiate 2.5 milligrams by mouth every day for 5 days, starting on day 3, 4, or 5 following menses or progestin-induced bleed. If ovulation does not occur at initiation, dose may be increased to 5 milligrams by mouth every day for 5 days on the next cycle. The max dosing is 7.5 milligrams per day, and the therapy was studied for up to 5 cycles. Off-label use for ovarian cancer, 2.5 milligrams by mouth every day until disease progression or if toxicity becomes intolerable. Mechanism of action and pharmacology. Letrozole decreases the amount of estrogen in the body, which causes the growth of some breast cancers. It is a competitive non-steroidal aromatase enzyme inhibitor. The drug binds to the heme group of the cytochrome P450 aromatase enzyme, which significantly reduces estrogen levels in the plasma without affecting aldosterone and androgens or thyroid and adrenal hormones. Absorption is rapid. Letrozole is hepatically metabolized via the CYP3A4 and 2A6 to the inactive metabolite. Excretion is 90% in the urine. Regarding time to peak, the plasma steady state is seen within 2 to 6 weeks. The half-life elimination is around 2 days or 48 hours. Protein binding in plasma is weak. Special populations and considerations. Patients with mild to moderate hepatic impairment experience a 37% higher AUC and a 47% reduction in systemic clearance when severe hepatic impairment is present. Women who are pregnant should not handle or inhale dust from this medication. Concern for CNS depression causing dizziness and fatigue. There is a decrease in bone mineral density, and that has been seen 2 years after use in patients on letrozole. There's a 3.8% decrease in bone mineral density compared to the 2% in patients that are not on letrozole. Side effects. General side effects are hot flashes, hair loss, pain in muscle, bone, and joints, trouble sleeping, and dizziness. Some of the more common side effects are hot flashes specifically in about 50% of patients, headache, hypercholesterolemia, and weight gain. Drug interactions. General drug interaction concerns are with drugs that contain estrogens, such as ethinyl estradiol, conjugated estrogens, or estrogen blockers, such as anastrozole and tamoxifen. Tamoxifen may decrease letrozole serum concentrations. Letrozole may increase methadone serum concentrations. Monitoring parameters. Monitor cholesterol, hepatic function, bone density, and pregnancy. And of course, monitor adherence. Patient counseling information. Letrozole is not affected by being taken with food. The medication is used to treat breast cancer in women. Some of the most common side effects are hot flashes, nausea and vomiting, loss of strength and energy, and pain in the back, muscles, and joints.